Breaking news coming in from Karnataka, where the cabinet has decided to go in for a curfew and restrictions in the state given the rising COVID cases. Remember, Karnataka reported over 34,000 cases in a single day. That's the highest ever. Let's go across to NDTV's Maya for more details. Maya, give us the details. What exactly has been announced?
Well, there will be a curfew in place for the next 14 days beginning tomorrow. This is beginning tomorrow, so people do have time to actually get their essential supplies and maybe get to where they need to be. This was really bound to happen. We started with a night curfew in Bengaluru and 6 other cities. This followed to a night curfew across the state, and weekend curfews were also announced. In fact, the weekend curfew was held last weekend and also just was lifted this morning. So now this curfew for 14 days is really a desperate bid by the state government to try and control the numbers in Karnataka that have been soaring tremendously. We're talking about over 34,000 new cases in Karnataka, over 20,000 new cases in Bengaluru city alone. The city now has more than 1.8 lakhs active cases, which is really an enormous amount, and of course, really kind of putting a huge strain when it comes to the facilities, the ICU beds, the oxygen. ICU beds are running short in the city. So this bid, this curfew, as the Chief Minister calls it, is a bid to really kind of break the transmission, break the chain, try and give the health facilities a time to kind of stabilize, to try and catch up. They're talking about installing 2,000 modular ICU beds in Bengaluru, another 2,500 modular beds in the rest of Karnataka as well, to cater to the ICU demand. It's really a crisis situation in Karnataka, and this latest announcement of this 14-day curfew is a bid to break the chain and slow that spike.
All right, Maya, thanks so much for joining us with those details. So that's the big breaking news right now, a 14-day curfew and restrictions being announced in Karnataka. This was after a decision taken by the cabinet. Well, let's now go across to NDTV's Nihal for more on this story. All right, we'll just get Nihal in also on this story. But as Maya was telling us, it's a crisis situation in the state. They've crossed 34,000 daily cases for the first time ever. In fact, 20,000 of those cases are from Bengaluru city alone. So now a 14-day curfew in Karnataka. Let's go across to Nihal. And Nihal, tell us, why is it being called a curfew and not a lockdown? What is very different? If you could explain the details to us.
In strict practical terms, there won't be any difference, because if you see the modalities, it means there will be a complete shutdown across the state from tomorrow 9 p.m. onwards. When the Chief Minister was asked that whether it is a lockdown or a curfew, he said that I have used the term curfew. It is up to you in whatever way you want to use it. But there will be complete shutdown from 9 p.m. onwards tomorrow onwards, and for 14 days, because 30,000, more than 34,000 cases were reported in Karnataka on Sunday, and 20,000 cases were reported from Bangalore. So what they believe, that in order to break this chain, a 14 days lockdown was required as per the assessment, and even the technical advisory committee was also of this opinion, and therefore they have opted for this. It will be strictly implemented, and there won't be any laxity at all. So, but people have been asked to buy their essentials between 6 a.m. to 10 a.m. every day. Though medical shops, hospitals, and other operations will continue, even in this industrial and other economical activities would be allowed under certain guidelines, and the guidelines will be issued by today evening.
All right, the guidelines by today evening. It's a curfew that has been announced for the next 14 days. But as Nihal was telling us, by all intents and purpose, it is a lockdown that's going to be in place between 6 a.m. to 10 a.m. People will be allowed to go out and buy their essential items that they may require.